Hello cruel world, my name is Dr. Sohom. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. Today I'm going to talk about different types of psychotherapy that are available for violent offenders. I'm going to give you an overview of the different types of therapy, how they work, and what are the shortfalls. First of all, I'm going to tell you about a real-life horrific case of a violent man who certainly had anger management problems. I'm not going to deep dive into this case because the video will get too long, but it's just going to be a brief overview. So I educate whilst you reprobate. I educate whilst you vegetate. So just to be serious for a minute, I'm going to give you a trigger warning because what I'm about to talk to you about is actually quite sensitive. It involves the killing of a child. I will refrain from making jokes. So the perpetrator is Marvyn Iheanacho, who was 41 at the time. He had previous convictions for beating children and women and was living at his sister's address when he killed a 5-year-old called Alex Malcolm on the 20th of November 2016. Jurors heard that Iheanacho had taken Alex with him to pick up some DVDs from a friend in Catford, and on the way they both stopped at Mansfield Park, which is in southeast London. Iheanacho became enraged and he beat Alex after the boy lost a shoe. Witnesses heard a male voice screaming in the park whilst the child fearfully apologised, and the child sustained deadly brain injuries, internal bruising to his stomach. The post-mortem examination concluded that they'd been caused by kicks, stamps and punches. Iheanacho was later seen talking on his phone whilst the child lay on a bench next to him with a limp arm kind of dangling down. So rather than taking the boy to a nearby hospital, which was only 5 minutes walk away, Iheanacho took him home in a taxi where he attacked the boy's mother, whose name is 𝐏𝐬𝐲𝐜𝐡, when she tried to call an ambulance. Afterwards, Detective Chief Inspector Tony Lynes of the Metropolitan's Homicide and Major Crime Command Unit said the following: Iheanacho subjected that poor little boy to a brutal assault after flying into an uncontrollable rage just because Alex had lost one of his shoes. Then Miss 𝐏𝐬𝐲𝐜 went into Lewisham Hospital with a son, but before she could go there, Iheanacho instructed her exactly what to say to the hospital staff. Probation services who were supervising Iheanacho admitted that he was meant to be in secure accommodation at the time, but because there was a shortage of funds and a shortage of the accommodation, he was staying at his sister's. The mother, 𝐏𝐬𝐲𝐜, previously told the inquest that probation services had not warned her of a partner's violent history or asked if she had children. Ms. 𝐏𝐬𝐲𝐜 befriended him whilst he was in prison. So dear viewers, I know this is a sensitive topic, but I'm just interested to know your thoughts on the mother's role. Is she a victim here? Can she be held in any way responsible, or potentially both? I've got kids, and I have to say stories like this send a kind of tingle down my backbone. Okay, let's veer off topic, and I'm going to teach you a little bit about the type of psychological therapy that's available out there for violent offenders. Firstly, let's talk about low intensity therapies. So anger management is about cognitive skills, and it's short and intense. It lasts about 150 hours. It works best on one major factor, which is basically anger. So anger management is not only a trashy film by Adam Sandler, who in my opinion is probably the most overrated, overpaid actor of all time. I mean, everyone talks about how Uncut Gems was amazing, but really? I mean, was it actually really? Anger management is the most common type of approach for these kind of offenders. It's usually in the form of between 10 to 20 2-hour group sessions, and it increases awareness of anger. It teaches social skills and relaxation techniques so that when people recognize they're getting angry, they can suppress it. So for example, let's just take a random example. Say you make these really high quality YouTube videos, but your sub rate is very low and you're seething with anger, then you have to learn to control your feelings. For example, you have to go to your happy place, which is of course Nando's. Of course, not all violent, uncontrollable anger is at the heart of all violent offending, because some aggression is actually done in a calm and calculated manner, and it can be pre-planned. So anger management doesn't actually stop those types of crime. If you're interested, see my series on psychopaths to find out more about that. Next is the cognitive skills program. So this includes courses like reasoning and rehabilitation, advanced thinking skills. So basically that's about combating key entrenched antisocial cognitions, like I deserve to have more money for crack. That post office was insured anyway. They shouldn't have left their car unlocked. Bruno Mars has such a punchable face, he probably deserved it. So it challenges that type of thinking. There are new ways of thinking and problem solving, and it is fairly basic, to be fair. It's not really for serious high violence offenders. The next type of therapy is the more intense version of therapy, and this is usually about 300 hours, and it's more about developing social skills. See my video on why people commit crime, because that explains things like poor parental boundaries and how this leads to antisocial outlooks. Then on top of all that, for things like domestic violence, there are intimate partner violence programs, and these take a feminist approach. What I mean by that is they challenge thoughts about power and control. They challenge coercive attitudes, and they also teach about gender roles and about communication, such as communicating frustrations that are natural in all romantic relationships. Just ask my wife. And then on top of all of those things, there's also multimodal programs, and this is the gold standard. So these are the most effective types of therapy, and they're for the most violent offenders with the highest risk of recidivism. And they involve a multidisciplinary team. So they involve psychiatrists, psychologists, prison custodial staff, educational staff, a lot of different people, but obviously they're very high intense, very expensive. There's not always the resources. So all of this reminds me a little bit of the forensic psychiatric units, like where I work. See my other series on Broadmoor and those videos to teach you about how those teams function, because it's like a multi-layered approach. This type of therapy lasts at least 12 months minimal, and it's usually group therapy and individual therapy. So it's kind of tailored to the individual. It's kind of customized. Then finally, there's a CBT, which is the cognitive behavioral therapy for domestic violence. So that tackles the cognitive aspects. So those are thoughts such as seeing women as sexual objects, and the behavioral aspects, such as if somebody drinks or takes cocaine, then they're more likely to become violent. And then there's another sort of field of thought, which is called the good life model, and that's more about positive reinforcements. So for example, things like relapse prevention, those have negative connotations. Those take away things from people's lives. So for example, if you have a social circle with an underage victim, it teaches you to step away from that. So you're going away, you're getting less. Whereas the good life model is more about developing the social skills, such as employment, so you have a pro-social life. And it's generally more effective because the perpetrator has to be engaged and they can see the benefits in the good life model. Okay, so next question. What are the problems and the challenges of treating violent offenders? Before I answer that very important question, I would like to introduce you to this channel. So you are watching A Psych for Sore Minds. My name is Dr. Sohom Das. I'm a consultant forensic psychiatrist. I work in prisons and I assess defendants in courts and in secure psychiatric hospitals. This channel addresses a whole range of issues and topics, some related to mental illness, some related to criminality, some related to both. I talk about high-profile cases, I dissect individual psychiatric diagnoses, I interview ex-patients. What I'm trying to say is there's something for everybody in this channel. I implore you to subscribe because not only does it help me out immeasurably, but it actually makes Ellen DeGeneres be nice to everybody, guaranteed, or your money back. So let's get back to the video. What are the limitations in the therapy that I described? Well, the first thing is that there's limited resources. There's not enough money for especially the high intensity therapy for everybody. And also, as I said before, the low intensity therapy is mostly generic and it's not tailored. The other interesting bit, I think, is that there isn't really many studies about how effective this therapy is, because you can't have a randomized controlled trial, because if you do that, then you have to withhold treatment from the control group, which is unethical. So that's one issue. Another issue is you need to get the perpetrator to actually admit their crime, and a lot of people in prison just won't admit it. And there might be reasons that they might be reluctant. So if you're a sex offender in prison, and if you admit your crime, then you're opening yourself up to be abused, tortured, beaten up by the others. Another massive factor is the mistrust in the therapist, because they associate the therapist with the whole prison system, abusive prison officers, etc. So I think another interesting point is the treatment of psychopaths, and there's mixed evidence of this. Some of people say that by treating psychopaths this way, it actually increases recidivism because it teaches psychopaths what to say in treatment. I won't delve into what a psychopath is, but you can find out more on my series about psychopaths. I've done several of them somewhere on this channel. So to conclude, that was a horrific case of Iheanacho. Obviously I feel for the family of the victim. There are treatments available for aggressive, violent prisoners and perpetrators, although they're not massively affected, and there's lots of barriers and problems, as I've explained, but it's better to do something, and any kind of reduction in future violence, protecting future victims, has to be a good thing. I'm sure you'll agree. Right, I've rabbited on for long enough. All that remains for me to say is is watch out for my book. It's going to be called In Two Minds. It will be released in spring 2022. It's going to be awesome. Go cop it. Until next time, stay euthymic. Tell everybody you ever meet ever for the rest of your life about this channel, or I will kill you. And yeah, remember, do not forget, I love you.